So you've made the smart decision to save your hands and get better results in practice and decided to purchase the ProHealth proSTM Practitioner's Kit. So if we look at this kit, what does it include? A deluxe carrying case that makes it easy for travel or use in your clinic. Open it up. It also includes our Intro to Instrument-Assisted Soft Tissue Mobilization that goes through pain cascades and injury cascades, as well as basic identification of tissue-specific pathologies, history, evidence to support the technique. We also include thermal imaging to show differences in treatment using instruments and not using instruments, as well as why you're going to use IASTM and showing changes over time on different practitioners who've been practicing without instruments and wishing they had instruments earlier in practice. We also talk about which tools to choose, including references from our $35,000 plus wall of instruments that you can look at. Goes into different handholds for the specific instruments, the proSTM 1 tool and the proSTM 2 tool. Then we proceed into indications and contraindications for application, and then specific errors that you might accomplish when you're first learning how to do this and how to avoid those, as well as the dosing protocols that you might want to work on as well. Then we progress into basic strokes, so introductory strokes. Then we look at outcome markers, followed by what you should expect on your first visit, second visit, third visit. This is then followed by outcome markers that you'll use in practice with our online resources, as well as how to chart your findings and treatment options when you're using instrument-assisted techniques. And we then talk about basic healing cascades and tissue-specific differentials, as well as myofascial discussion with cadaver dissections and application of our stretching strap as well to save your hands and save your body a little bit more too. This then progresses into some specific case studies where we can see scar tissue formation, plantar fasciitis, Achilles tendonitis, and then a little bit of promotion material for the other materials that we offer. This kit also includes our stretching strap that you can use for active isolated stretching or any other type of stretching that you want to do to take pressure off of your body, so allowing the patient to use the strap to apply more or less force so they're more in control of the treatment. It also includes the proSTM 1 tool, which is one of our favorite tools to use. If you look at the design on this tool, it has variable edge technology on it, so it goes from dull edges into sharper edges into duller edges, and its organic shape and grooves allow it to sit nicely into your hand. Unlike other tool kits where you'd have to go ahead and put the instrument down and then go ahead and pick up another one, all you're doing here is using your instrument, flipping it over, and then using the other edge, moving to various different angles and arches to go ahead and change your dose specifics on that. And the other instrument includes is our proSTM 2 instrument. Now, for myself, I can't actually do pin and stretch on more than 2 or 3 people before my thumb starts to ache at the interphalangeal joint. If you look at that shape, that is exactly the shape of your thumb right there. If you look at this shape, it is exactly the shape of your knuckle. And so you understand the biomechanical advantage you get. If you look at this, now the weight goes through the palm of my hand where it's supposed to bear weight rather than through my thumb, and that force can be generated in, and I can still contact the tissue, or I can go reinforced over top of it, however you want to move. The same thing for the knuckle edge. This edge right here, these 2 little nubs, are designed to go in the spinal laminar groove and are perfect for suboccipital release. So many of us have worked before where you're holding the suboccipitals and then you can't even hold a pencil after you're done your treatment. This takes that pressure off the small joints of your body. And then the other thing you can see here, of course, is the thumb side setup, or sorry, the spoon setup. And that spoon is designed to go ahead and give you an edge that you can use much like a edge to go ahead and stroke through the tissue and get deeper contact. One of the big things that we are all about with our online CE and in-person seminars is neutral wrists, relaxed hands. And if you look at this position to work through the tissue through this tough, thick carpal tunnel region right here with the transverse carpal ligament and all the thick fascia and thick skin in this region, you look at my wrist, nice and neutral as I work through here. Other contacts would include reinforced thumb contacts or even contacts like this to work through the arms, and you can work through clothes or directly on the skin, either way. But this should give you a good summary of what your kit includes, and hopefully you will enjoy it as many as hundreds and thousands of other practitioners have, and I thank you very much for your time.